Good afternoon. Welcome back to the last technical session of IOM. It's a pleasure to introduce Professor Ali Trabolsi. Professor Trabolsi comes from Lebanon. He did his PhD at Strasbourg, followed by postdoctoral work with Sir Stoddart at UCLA and Northwestern University. And presently, he is a professor and program head at the Department of Chemistry at New York University, Abu Dhabi. Today he will be talking to us about covalent organic frameworks for precise drug delivery.
Well, good afternoon, and thank you for the introduction. It's my pleasure to be here. It's the first time I attend IWAM, and I've been enjoying a lot. And today I'll show you how we use covalent organic frameworks as drug carriers, as drug delivery systems, and more importantly, how we can achieve precise and personalized treatment, because I strongly believe that it's about time that we move away from treating everyone the same way, because it simply doesn't work. And I'll be talking about two types of drugs, anti-cancer drugs, as well as the oral delivery of insulin. But before I do so, this is just a roadmap that shows you how our technologies and our designs have developed throughout the years since I joined NYU AD in 2011, starting from using nanoparticles, such as iron oxide nanoparticles or silver and gold nanoparticles, all the way to 2018, when we started using covalent organic frameworks for biological applications, such as imaging and drug delivery. And a big shout out to Farah, who has been leading this area in my group since she joined me actually in 2012. So when it comes to anti-cancer drugs, I probably don't have to tell you how invasive chemotherapy is. So most of a large percentage of patients actually, they end up dying from the treatment itself rather than dying from cancer. So anti-cancer drugs, whether they are small organic molecules or platinum-based drugs, they suffer from a lot of limitations. They have to be actually, once administered in the body, they do not differentiate between healthy cells and cancer cells. They pretty much go everywhere. They have to be administered repeatedly to make sure that the right dose reach the tumor. And cancer cells are very smart. They developed what we call drug resistance, and that's why a cancer patient, when they undergo chemotherapy, these sessions are phased out. You cannot treat them very often, because the cancer cells will start recognizing the drugs and eliminate it without any efficiency. And that's why they are associated with a large number of side effects, from hair loss to weight loss to heart damage, liver dysfunctions, and many others. It has also been shown and proven that using a drug delivery system such as nanoparticles will eliminate partially or totally the side effects of the drugs, because these systems will enhance the lifetime circulation of the drug in the body. They will enhance the accumulation of the drug in tumors through what we call passive targeting. They can also be chemically modified to achieve what we call targeted delivery. And they also enhance the pharmacokinetics and dynamics of the drug. Our nanoparticles that we are interested in, as I said in my introduction, they are these covalent organic frameworks that were first introduced to this world by Professor Omar Yagi. And as you can see, these are highly ordered and porous organic materials with tunable pore size and shape, which is really beautiful about these materials, that you can really tune their properties at the atomic and molecular level. You can change the shape and the size of the pores, and you can prepare them to be responsive to external stimuli, as I'm going to show you in a little bit. So we prepare them as nanoparticles of 100 nanometers in average, and they are biocompatible. They are not toxic, and we've been studying these materials for many years now. So when it comes to delivering anti-cancer drugs, we took advantage of the difference in the physiology between healthy tissue and cancer tissue, knowing that the microenvironment of tumors is more acidic than healthy tissue. So we're talking about 7.4 for healthy tissue versus it can go all the way down to 6.2 for the microenvironment of cancer tissue. So for this reason, we designed this covalent organic framework, and we synthesized it in the form of nanoparticles of around 300 nanometer with a surface area of around 500 square meter per gram. And these nanoparticles, they were stable at physiological pH and temperature, as you can see right here from the TEM images. However, when we acidify to around 5 or even 6 to mimic the microenvironment of tumors, they completely disintegrate, as you can see from the TM image right here. And you can follow this process as well by DLS and by powder XRD. So after synthesizing these nanoparticles, we load them with an anti-cancer drug, which is doxorubicin in this case. And we choose doxorubicin because it's fluorescent and it's very easy to monitor and to follow once it's released. But we wanted to have an additional control of this system, and that's why we decorated the surface of these nanoparticles with magnetic iron oxide nanoparticles of 10 nanometer. And the choice of the size of the magnetic nanoparticles here is very important. You don't want your nanoparticle to be too small, otherwise they will diffuse in the pores of your cough and replace the drug. So these nanoparticles would allow us to achieve actually 3 properties. First, these magnetic nanoparticles can be used to achieve what we call magnetic targeting. We have proven and we have demonstrated that if you have a magnet, if you place a magnet next to the tumor and inject these animals with iron oxide nanoparticles, with magnetic nanoparticles, the highest concentration of the nanoparticles will be located where the magnet is. In addition to magnetic targeting, iron oxide nanoparticles are well known to be used as MRI contrast agents, so you can do diagnosis, so you can follow the system in the body as well. And more importantly, they can be used as heat mediator, which means that if you expose them to an external magnetic field, they start vibrating and they will increase, they will raise the temperature of their environment. And by doing this, we can actually combine chemotherapy with thermal therapy. And combined therapy is very important to overcome the drug resistance that cancer cells develop over time. So at the end of this step, we stabilize the whole system with a polymer that is pH responsive as well as heat responsive, and this is polylysine. And what's really beautiful is that you can follow the process by TM. You can see the changes as well as by DLS that measure the change in the surface charge. So these nanoparticles were stable at physiological pH and physiological temperature. and even when you expose them to an alternating magnetic field at physiological pH, we don't see any release of the doxorubicin. However, when we acidify, you can see that we start observing a slow release of the doxorubicin followed by emission. And then when we combine this with an alternating magnetic field, we speed up the release. So we have this burst release that we can follow by emission as well. So we have a control over the release. You can have a slow release of the drug or a fast release of the drug in addition to hyperthermia or thermal therapy. And you can follow the whole process by imaging as well. So we took this system and we incubated with 2 cell lines, a cancer cell line, a cancer derivated cell line, and a non-cancerous cell line. And we always compare the efficiency of our system to the free drug doxorubicin itself. What you observe here is that the nanoparticle, our system, is more toxic on cancer cells than the drug itself. However, on healthy cells, as you can see right here, our system is not toxic at all. We were not able to observe any toxicity on healthy cells. However, the drug itself remained very toxic. And this is related to the mechanism of internalization between the between the nanoparticles and the drug that diffuses through the membrane. However, these nanoparticles are actively recognized by the cells, and they are internalized through what we call receptor-mediated internalization. Also, what we have observed is that when we have a magnet, so we place a magnet underneath our cells, and we enhance the internalization and the toxicity of our system, which tells us that we might be able to enhance the targeting through magnetism. So in order to validate the fact that we can combine chemotherapy with thermal therapy, we took our cells that we exposed them to an alternating magnetic field. So these are the cells without the nanoparticles, and you can see that we can increase their temperature to 33, which is very known phenomenon. However, when we incubate them with the iron oxide nanoparticles, with the whole magnetic system, we were able to increase the temperature to 40 degrees. And 40 degrees is enough to weaken the cells and to make them more responsive to the drug. And what we have observed from the cell study, that when we have a combined chemotherapy and thermal therapy, so when we have the alternating magnetic field, we were able to achieve a higher rate of cell death. Then we moved to in vivo study using zebrafish embryos. That was the only model that was available to us at NYU AD at that time. And zebrafish embryos is a good model for cancer. So we took these zebrafish embryos and we incubated them with our system as well. And you can see that the highest rate, so we have a complete death of the zebrafish embryos when we have alternating magnetic field, so when we have a combined therapy. So someone might argue that doing a magnetic targeting might not be very efficient in many cases. So it might work when you have a tissue that is near the surface. That's fine. You can place a magnet near the tumor, and you can enhance the accumulation of these nanoparticles in the tumor. However, if you have a tumor in deep tissue, it becomes more difficult. That's why we have developed another strategy that relies on molecular recognition. So we took the same covalent organic frameworks, but in this case, we have this additional unit. We have an alkyne that allows us to click any additional unit here, which will allow us to target specific cancer cells. Because as we know, cancer cells, many cancer cells, they overexpress receptors on their surface. And we know a lot about cancer cells nowadays. We have done a lot of profiling, and we know exactly the type of receptors they have on their surface. So here we opted for this peptide that is very well known to target triple-negative breast cancer cells. So that's what I just said. So we have these nanoparticles with this little green unit on their surface that will go and target specifically these cells with these receptors. So this would allow us actually to achieve precise and personalized treatment, because these receptors will differentiate from between different types of cancer cells. So if you functionalize these nanoparticles with the right unit, you would be able to achieve precise treatment. So these nanoparticles were loaded with the same drug, which is doxorubicin. They were stable at physiological pH and temperature. We observe 20% leak of the drug, which we associate with the drug that is on the surface. However, when we acidify to mimic, again, the microenvironment of the tumor, we have a complete release of the drug, and this is because the nanoparticle will disintegrate completely at acidic pH. So now, to validate our hypothesis that we can achieve a higher internalization in triple-negative cancer cell lines, we incubated our nanoparticles with 2 cancer cell lines. They are both breast cancer cell lines. So here we have an MCF7, which is not aggressive and does not feature a lot of receptors on the surface, versus this MDA MB231, which is very aggressive and has a lot of these receptors on the surface. So we incubated these 2 cell lines with the nanoparticles that were chemically modified with the peptide, and we compared them to the nanoparticles that were not modified with the peptide, as well as the free drug. And what we have observed that in both cases, in both cell lines, the highest internalization was achieved when we have these nanoparticles, when we have the peptide. Because even in the cell lines that were not aggressive, they still have some receptors on their surface. But as you can see here, the highest internalization was achieved with this one in the cells that were aggressive and have a lot of receptors on their surface. You can follow this by fluorescence imaging, and you can see that the highest intensity of the drug was observed with this system right here. And what's really interesting, that using 2EM, we were able to observe the difference in the mechanism of internalization of the 2 nanoparticles, the one that were not modified versus the one that were modified. You can see right here that for the non-modified nanoparticles, they are endocytosed through a mechanism which we call micropinocytosis, which is characterized by the formation of this large vacuole inside the cells. So they will aggregate at the surface of the cell, and then they are internalized. However, when you have these chemically modified nanoparticles, you see individual nanoparticles interacting with the membrane of the cells. And this is an indication that we have a receptor-mediated internalization when we have the peptide on the nanoparticles. So we administered these systems in vivo in xenografted mice. And after 1 day of treatment only, we were able to observe that this system that were chemically modified with the peptide was able to achieve the highest accumulation of the drug in the tumor. So this is only after 24 hours of treatment. So we have to kill these little poor mice and collect their tumor. And you can see again the highest emission was observed with this system right here, which is really interesting. We were not able to see any accumulation of the drug in the major organs such as liver, heart, and spleen as well, and kidney. After the full treatment, that was 20 days of treatment where the mice were injected with the drug every other day, what we have observed that only the mice that were injected with this system, with the chemically modified system, were able to actually clear out the tumor. So only these nanoparticles were able to inhibit the growth of the tumor. What's really interesting as well is that all the animals that were treated with the nanoparticles, whether they are modified or not, did not show any loss of weight compared to the one treated with the drug itself. And this is because the drug, as you can see from this image, it goes pretty much everywhere. And as I said at the beginning, it's very invasive. So chemotherapy is very invasive compared to targeted delivery. And as you can see, we don't observe any drug accumulated in the body of these mice by the end of the treatment. So again, we collect the tumor. As you can see right here, this system, the nanoparticles that were modified with the peptide, you see that the growth of the tumor was inhibited, and in some cases it was completely cleared out. The highest concentration of the drug was observed in the tumor, and unlike the drug, where it was observed in all major organs, so you can see here from the emission, for the nanoparticles, we didn't observe any accumulation of the drug in the organs. That was my first message. I hope I made it very clear that we should move away from treating everyone the same way and practice what we call precise and personalized medication. So moving away from drug delivery of or anti-cancer drug to the oral delivery of insulin. As you may know that we cannot take insulin orally because it gets digested in the stomach for many reasons, mainly because of the low pH in the stomach. It does not get absorbed by our body, and therefore it has no effect. And that's why insulin has to be injected subcutaneously under the skin. So we thought that if we can design a material that can transport the insulin throughout the stomach without being exposed to the harsh condition of the stomach, and release it at this stage, at the intestine stage, we might be able actually to mimic what happens in a healthy body. Because as you know, like insulin is secreted by the pancreas, it goes to the liver through the portal vein, and then the liver takes control over our body. So if we can deliver the insulin at this stage, it's going to cross the walls of the intestine, goes to the liver through the portal vein, and then we are recreating exactly what happens in a healthy body. So basically, we are creating an artificial pancreas. And that's what we've done. We've done this, we synthesized this cough that looks exactly like the cough I've just shown you for the anti-cancer drug delivery, but this one was extremely stable under acidic conditions. The only change is this unit right here. If you remember, in the first cough, we had a benzene ring. By alternating the benzene ring, by substituting the benzene ring with a triazine, the cough now is very stable under acidic conditions, as you can see from this TM image right here. So we prepare them in the form of nanoparticles, 120 nanometer. They are porous with a surface area around 400 square meter per gram, and they were not toxic. We took these nanoparticles, and then we load them with insulin, and we were able to achieve a very high percentage in loading capacity. I think that was the highest reported so far. And this is a snapshot that shows the interaction of the insulin with the organic layers. And here, I think we were very lucky to have the right interactions between the insulin and the organic materials. You don't want your insulin to be strongly interacting with your materials, otherwise not going to be released. And you don't want it to be loosely interacting with your materials, otherwise it's going to it's not going to make it throughout the stomach. So that was probably one of the most exciting results we got in my group. Here I'm showing you the blood glucose level of two rats. One they were non-diabetic versus rats which are diabetic, type 1 diabetic. When we inject them with insulin subcutaneously, what we have observed that we have this sharp decrease during the first hour of the treatment in their blood glucose level, but then we have a progressive increase to go back to the level of diabetic, or to their initial diabetic level after a couple of hours. If we give them insulin orally, nothing would happen because the insulin will get digested in the stomach. The particles that were insulin-free did not have any effect. However, when we have our nanoparticles that were loaded with the insulin, as you can see right here, we have this decrease in the first 2 hours, but then we have a stable blood glucose level over the next 8 hours. So we've been very successful at stabilizing the blood glucose level of these type 1 diabetic rats. And we have new results that shows, so after, if you're asking what happens after the 10 hours, it starts increasing, but we have a new version that actually stabilizes the blood glucose level over 24 hours. So not only these nanoparticles were able to deliver insulin orally, but what we have observed that there is a healing effect of the systems. So all the side effects of the subcutaneous injection of insulin were eliminated when we deliver insulin orally. We didn't observe any lesion in any of the major organs such as heart, the liver, and so on. And we have a restored kidney and liver functions. In addition to this, what we have observed also that the rats that were injured, they will heal faster than the one that the rats that were treated with the oral insulin, that will heal faster than the one that were treated with subcutaneous insulin. So we have a healing effect, which is very important. So these nanoparticles or these organic porous materials, not only they can be used for drug delivery as I've shown you, but we were also interested in tuning their properties and changing their characteristics for many other applications, including water harvesting and water purifications. So if I get invited again next year, I can talk about this part. We're also interested in making them responsive to external stimuli, and that's why we equip them with molecular machines or molecular switches. And this is a collection of some responsive materials that we were able to develop in my group by embedding molecular switches either as linkers or as pendant units, as you can see right here. And they can crawl, they can bend, they can heat up, or they can change their color as a response to an external stimuli. That brings me to the end of my talk. I can only thank my research group for all the hard work that they've been doing throughout the years, and especially Farah, who was leading this drug delivery area in my group. Of course, I would like to thank all my collaborators, all the funding agencies, the organizing committee again for inviting me. I would like to thank you for your attention.